with you, Doctor, there in America, because Dr. Kuppalli, we've seen that the US seems to be ahead of the curve, whether it's in vaccinations, 40% of the population vaccinated, or indeed in lifting restrictions, more and more restrictions being lifted. Tell us, what's the way forward, lockdown or vaccinations in your view?
Yeah, that's a really wonderful question. So I think that it's a combination of things. I think first and foremost, you have to stop ongoing transmission. And as we know in India right now, the rates of transmission are still extremely high. And so one of the ways you do that is by having potentially targeted lockdowns in areas where we're seeing rates of transmission high. The other thing to do is also to really reinforce these non-pharmaceutical interventions. So things like wearing masks, maintaining physical distance, trying to abstain from large crowds of people outside of your home, and also maintaining good hygiene. And then I think the other part of that is also trying to scale up a vaccine campaign. So I think that as we've seen, not just in the United States, but Israel, places that have been able to vaccinate quickly, we've seen case numbers come down. So I think it's a combination of all these things.
You're saying it's a combination, but would you say that the key factor in the United States success, if I may use the word, in the last few months has been vaccination? That the faster and the more you vaccinate, that really is critical, even more than having lockdowns?
Well, so yes, vaccination is extremely important, but when you're in a surge, you can't vaccinate your way out of a surge. And so when you're in a situation as we're seeing in India right now, you can't just plan to vaccinate your way out of surge. Remember, it takes a couple weeks to develop antibodies. And so while you're vaccinating, and that's very important, you also have to reinforce these public health measures to prevent ongoing transmission.
Okay. Let me get the experience that from the United Kingdom now. Dr. Manish Gautam, your experience from the United Kingdom, what works? Because the UK is also lifting restrictions at the moment. I know there have been a sudden rise in cases in the last few days, but the general impression is that your vaccination drive has also been very aggressive. So is it an aggressive vaccination drive that is key to containing the pandemic, or is it an effective lockdown?
Thanks, Rajdeep. First of all, thank you for putting this panel together, where I'm actually talking to intellectuals. So it's really helpful. Any sort of intellectual conversation on COVID is the need of the hour. So coming to the UK strategy, we got things wrong here in the beginning. The lockdown was not implemented at an earlier stage. Obviously, that did have some negative repercussions. But I guess the most important thing in this situation of COVID-19 pandemic is learning from mistakes. And I think one of the things UK has done reasonably well, learn from mistakes which were done at the beginning of the pandemic. When we came across second wave and the third wave, all the mortality was high because the virus was more virulent, but we were able to manage our day-to-day operational side of things in hospitals in a much better way. And what obviously has helped the UK in keeping things under control is massive drive on vaccination. And I say it's one way to control pandemic. Well, I think the only way to control pandemic is trusting your academics. So that's what has happened. UK relied on research, led from front in the area of vaccines, and massive drive has actually helped to keep things under control. However, with the arrival of the strain which originated in India, we are seeing increased number of cases here. Therefore, the UK government has tried to speed up the second vaccination dose. And also, we're reviewing the opening of full lockdown in 3 or 4 weeks' time. That potentially can get delayed. But overall, we're in a much better state than we could have been.
I'm going to come to whether, there are certain strains of this virus that escape vaccines, because that's an important element. I'll come to that in a moment.